Chamber?
Oh, I thought you were just pointing.
Can't say the atrium, right?
Right atrium. Chamber?
Left.
Left atrium. Wrinkled stuff here. Auricle. Left atrial auricle. Right atrial auricle. Chamber? Left ventricle.
Right ventricle.
Right ventricle. Let's open it up. Okay, inside the right ventricle, I have the two nodes, SA node and AV node. So in the wall over here, that's your SA node, and then over here on this wall, there it is down there, AV node. All right, the SA is 32, the AV is 36. And then inside there, you see that 55, it's that white sort of circle 55. That's your coronary sinus.
Where?
Okay, now, what is this valve right here?
A mitral.
Between right atrium and right ventricle?
Mitral.
No, not mitral.
Bicuspid.
No, not
Oh,
bicuspid.
the valve? This
Yeah.
pulmonary semilunar.
No, you're going all the way
Wait a
around.
minute. Which one
Hold
is
on. Right here. Right here. Between the right atrium and right ventricle. It's, well, first of all, guys, in
many
terms
does it
of
have on it?
AVs, hold on. In terms of AVs, it's the right AV valve. That's
Okay,
why
that's
I'll
what you
take that. Now, if you want to be fancy and call it the tricuspid, you could do that.
Okay.
Now, how do we know it's a
It
tricuspid?
has three
Look at these three little tags. There's your tricuspid. Now, let's look at that valve closely. What are these strings on the valve?
Chordae tendon.
Chordae tendineae. And they're attached to those red tags. What does the red tag represent? Papillary muscle, which is a specialized form of all this raised, bundled, wrinkled muscle we find in the ventricles called
The
T.
tendinae. Something
Trabeculae carnae. Trabeculae carnae. So, one more time. It's the right AV valve, or tricuspid. It's the chordae tendineae. It's the papillary muscle. It's the trabeculae carnae, trabeculae carnae, trabeculae carnae, trabeculae carnae, all these raised bundles. Okay, now if we look right above, we see this other valve up here. What valve is that? To the right side of the heart. Pulmonary semilunar valve. Okay? Now let's go over to this other side. And we have this valve in between left atrium and left ventricle. What's this?
Bicuspid?
Bicuspid or
Left AV valve.
left AV valve. Okay, again, we have two papillary muscles and the chordae tendineae, of course, trabeculae carnae. If you're going to see the aortic semilunar, you have to kind of lift all this up and look underneath, and you see that aortic semilunar, it's number 45 under there. Okay, aortic semilunar valve. All right, now, what vessel is this?
Pulmonary trunk.
Pulmonary trunk, or I'll take pulmonary artery, either one. This right here, ascending aorta,
Arch.
aortic arch. This vessel right here,
Superior.
superior vena cava, down below here, inferior vena cava. Okay, now continue on with that conduction system, right? We have the SA node here, we have the AV node there, and then we have the solid lines right here on either side. White solid lines. What do they represent?
Bundle His.
Bundle of His. We have the right bundle of His. We have the left bundle of His. Then we have these branches here. What are they called?
Left and right bundle. His
Bundle,
branches.
left and right bundle branches. Not Purkinje yet. So right bundle branch, left bundle branch. Now we see these branches continuing the lateral walls of the ventricles. What are they called now?
Fibers.
Those are Purkinje fibers. That's it. What's this big meaty partition between the two ventricles?
Septum.
What do we call that septum?
Interventricular.
The interventricular septum. What are these vessels right here?
Pulmonary veins.
Pulmonary veins. What is this thing with the C-shaped cartilaginous rings?
Trachea.
The trachea. What's this flat tube?
Esophagus.
The esophagus. What's number 14? Don't worry about it. You don't have to know it.
Wait.
It's going to be subclavian or brachiocephalic. Okay, so that's it on the heart.